Now, in this section, we'll be dealing with the estimations from the skeletalized remains. Now, at this point, we are dealing with a skeletalized remain, not with a fresher body, that you have to keep in your mind. And we have already calculated in detail the sex of the person, how is it calculated. And now we are moving on to the other estimations that we can find through the skeletalized remains of any person. It can be fragmentary, it can be a whole stature of the person, and we have to establish the identity of a person to as much accuracy as possible at this level. So in this section particularly, we'll be dealing with the evidence of pregnancy. So even it is of higher importance that the skeletalized remains can even point out towards the changes of the body that the body has to deal with during pregnancy. Even the estimation of the stature can be made, the real life stature along with the soft tissues can be made through the skeletalized remains. And then most importantly, the estimation of the age of the person. That is a whole topic and is dealt in even, we have started on in this section, and that is dealt in the relevant section. So the sex determination from the other bones. Now the sternum may be helpful in that the length of the manubrium in the female may equal or exceed half the length of the body. So it is sometimes of a view that if only the sternum is available, it can be dealt in with whether it is a male sternum or if it is a female sternum. So this can be one of the things that we can deal with. Then we have the manubrium of the male is less than half the body length. So this is also one of the points that we have to deal in with when we are sex determinationing the bones of a certain person. In general, what do we have to keep in our mind? The male bones, whenever we are comparing any male bone with a female bone, the male bones are more larger, they are more rugged, they have more muscular prominences. Even when we weigh them comparatively, the male bone will be a little heavier and the female bones will be lighter. So all of these general characteristics we have to keep in our mind, and even the certain characteristics, whatever bone that we have found at the crime scene, we can even deal with that particular bone. The skull, as we have already discussed, it has its own, for example, the supraorbital ridges, the nasion, the glabella, and the mastoid. All of these things basically come into play whenever we are differentiating the male skull from the female skull. And the pelvis, of course, it has a lot of differences whenever we are basically comparing the males and the females. For example, the inlets, the outlets, the ischiopubic angle in the males is basically 90 degrees, and in the females it is basically 90 degrees, and the males it is lesser than 70 degrees. So all of these basically differences in the males and females is even the physiological functions that the females have to perform, that is the childbearing function, that is the mainstay basically, and it is basically performing all these differences are basically contributing towards the childbearing function of the females. So we have to keep all of these things in our mind whenever we are sexing the bones, that whatever bones we have found at the crime scene. Now, the presence of a perforated olecranon fossa at the lower end of the humerus, it occurs more often in the females and more commonly on the left side. So there are certain findings that we have found more frequently in the females than in the males, and we have to keep them in our mind as well. Now, moving on to the evidence of pregnancy from the skeleton. Parturition causes some changes in the pelvis as a result of the local trauma of the childbirth, and which is reinforced by multiple pregnancies. So there can be fractures of the head of the femur, even that is contributed towards the parturition process. And all of the physical findings that I've already told you that are contributing towards the childbearing process, the sacrum, the ileum, the pubis, they can be even pubic fractures while the childbearing process and while the process of the parturition it comes in handy. All of these things come into play. include the pubic scars from tearing of the tendon insertions and the periosteum around the pubic bone. And use of the dorsal pubic surface and the preauricular sulcus is somewhat controversial. So all of these things basically they come into play. And now moving on to the estimation of the stature from the skeletal remains. So that is basically the mainstay. How do we basically calculate the stature of a particular person? The male whites are basically differentiated from the male Negroes, and the female whites, on the other hand, basically they are differentiated from the female Negroes. So the formulas are different for the male whites, the female whites, the male Negroes, and the female Negroes. Because of their racial characteristics, because of their ancestral characteristics, it's very important. There are some basically statistics that we have to add on and we have to subtract or add on. Even if we look at the table over here, it's the femur plus the fibula that is contributing towards this formula calculation. And then we can have a single tibia on that we have at our hand, and we can still calculate the whole stature of the person. Then we have the humerus and the radius on the other hand, and we can still calculate the stature of the person. The humerus and ulna can be added together and they can be put in this formula, and we'll calculate the stature of the person. So these are basically the findings that will contribute towards the calculation of the stature of the person. Now we have to keep certain points while we're calculating these statures. There's always a chance of error whenever we are calculating this stature. What basically happens is after the rigor mortis, all of the muscles, they go into contraction. This is basically the decomposition stage that we are following after death. So it will basically subtract some of the centimeters or some of the inches that we can add on to the stature. And on the other hand, there can be a lot of decompositions that are going on inside the body, and that is how some of the centimeters or the inches can be lost by the person after death. So we have to keep all of these variations in our mind whenever we are calculating the stature of the person. This is another formula basically that for the calculation of the stature, in which if we have a single bone at our hand, a humerus, radius, ulna, tibia, fibula, if we have these at our hand, how are we going to calculate the stature of the person? This is calculated basically in this formula. So estimating the subject's age from the skeletal structures. Now, the greater the personal age, the less the confidence quotient. So we have to keep in our mind that as the aging process goes on, there are certain characteristics, of course, the acrus senilis, the osteoporosis, they come into play. And all of these can basically change the variations that occur basically whenever we are identifying the subject's age. So we have to keep all of these things in our mind. There are certain characteristics. The mandible basically goes into a lot of changes along with the age. So even the mandible, the pelvis, all of the bones, but there are certain characteristics for each bone. And that will be dealt in later on. So that is basically what we have to keep in our mind whenever we are aging the bones. So in this section, basically we dealt with what are the other estimations that can be made from the skeletalized remains, which are of particular importance whenever we get our hands on. That was the end to this section. Thank you for watching sqadia.com.